Good afternoon. Thank you all for being here. Excuse me. I, along with all of my fellow Alabamians, have been monitoring closely the rapidly changing development of the coronavirus in our state. As a state, we have taken preliminary measures and made preparations in the case that this virus would eventually reach our state. Our first case of confirmed case was announced earlier today. As I've emphasized time and time again, the safety and health of all Alabamians is paramount. A short time ago, we heard from President Trump, who officially declared a national emergency amidst this outbreak. And this declaration will certainly help us states around the country continue to work to mitigate this virus. In Alabama, we want to work in conjunction with these efforts, and to that end, I am now issuing a state of emergency for our state of Alabama. The state of emergency will strengthen our efforts and plans already in place, helping to alleviate our health care facilities and providers, our schools, and in turn, citizens across our state. Additionally, effective Wednesday, March 18th, at the close of business, all public K-12 schools across the state will have a 2.5-week break. This is in order to reduce the risk for students, teachers, and others from potentially being exposed to the virus. Folks, let's take a common sense approach and remember that calm and steady win the race. Alabamians should not be fearful, but instead use common sense to watch out for ourselves and for others. We will remain engaged and continue to closely monitor the situation to help keep Alabamians informed on all of the facts. The safety and well-being of our citizens is of the utmost importance. Again, I appreciate the hard work of our State Health Officer, Dr. Scott Harris, State Superintendent Dr. Eric Mackee, Alabama EMA Director Brian Hastings, members of my task force, and countless others. We will handle this situation together. Now I'll turn the program over to Dr. Harris.
Thank you very much, Governor Ivey. Thank you. I'm Scott Harris. I'm the State Health Officer. We appreciate you joining us this afternoon. Thank you to Governor Ivey for your leadership on this issue. I've spoken to you a few times from this position over the past few days, and we are grateful that the governor has decided to declare this state of public health emergency. We think that's exactly the right response, and that will help us so much in our ability to carry out our public health functions and make sure that we're protecting the health and safety of all Alabamians. I have some additional information to let you know about that we have just learned about in the past few minutes. We had a second confirmed case of the coronavirus that we were just notified of less than 30 minutes ago. This was from a person residing in Jefferson County. That patient and that patient's physician have already been notified of that. This is a person who has been isolating at home because of illness. Jefferson County Health Department is involved with that process, as are ADPH staff who will be a part of that investigation as well. I would say that this is a very fast-moving situation. We're not surprised to have additional cases, and we have been expecting this for some time. I would say that also that in the past 5 to 10 minutes, just as we were preparing for this press conference, we have some preliminary reports of 3 additional cases, so that would bring us to a total of 5. I don't have full information on that at this time about those locations, but we'll try to provide that for you as soon as possible. Again, this is something that we have been expecting. We have known that we probably had disease transmission in our state, but as we have ramped up our testing capacity, we are starting to find these cases just like surrounding states have had. We have a number of responses that I've talked to you quite a bit over the past few days. One additional thing I'd like to let Alabamians know about tonight is we have a call center that will be established starting at 8 a.m. Tomorrow to answer questions and help people who are concerned about whether they are need testing to call and get information on how they could obtain that. This is not a medical information call line to talk to a physician or to get a diagnosis, but rather it's a call line that will give you information about how you might be tested depending on where you live and whether you have a doctor. The number for people to call starting tomorrow is 1-888-264-2256. I'll repeat that, 1-888-264-2256. This is a toll-free hotline for people to call if they have questions about whether they need to seek testing. This will put them in touch with their own provider if they have one, or try to connect them to another provider who can help them make a decision about that if they do not have a provider relationship already. Again, that will go live tomorrow morning at 8 a.m. I'm sure there will be many people called because many people are concerned about this, so continue to call. We'll increase capacity on that hotline as needed, and so that way everyone will have an opportunity to call and reach someone and speak to a person about that. That's all the new additional information I have at this time. We'll take questions in a few minutes if you have additional questions, but at this time I'd like to turn the podium over to Dr. Eric Mackee.
Thank you, Dr. Harris, and certainly thank you, Governor, for being proactive. We were very fortunate that the Governor called a task force together several days ago and got way ahead of this before we even had one confirmed case in the state. So we're able to react very quickly as new cases are confirmed. We're also fortunate that she's been very proactive to go ahead and make a decision about what to do with our schools. As the Governor said, we'll be closing school at the end of business on Wednesday. That gives parents 3 days extra to begin working on and thinking about child care. We didn't want to do something that was too quick, because we know that parents need some time to make those decisions for their children. But we will close on Wednesday. We will be closed the 2 weeks following that, and then we will make a decision, working with public health and with the Governor and her task force during that 3rd week about what we need to do going forward. We will not wait until the last minute. Obviously, things are changing very fast, but we want to give, as we make changes then and make decisions about what we have to do after that last week of the closure, we'll make that decision as quickly as we can based on the information that's available that week. I'm going to also turn it, I think we're going to have questions now. Dr. Harris is going to moderate the questions.
Thank you, Dr. Mackey. Questions? Yes, Lydia.
Yes. Is there a second case in Montgomery? Baptist East put out a press release saying a person in their hospital has it.
I do not know of a second case in Montgomery County so far. I know of one that is in Montgomery, one that is in Jefferson. We did have a report of these 3 others that I just learned about and have very preliminary information about. I don't know where they're located. I think our staff has that information. I honestly just haven't been briefed because we were walking into the room when those reports came through.
You said earlier that the state started testing in-state last week. Following that, do you expect more cases to come out?
I think that's very likely, given what we've seen around the country. When we first rolled out our testing, if you remember nationally, all of those tests had to be sent to CDC. It was a slow process and difficult to get tests done because there just wasn't enough capacity initially. Now that states have begun testing, almost all states were testing by the end of this past week. We are beginning to identify cases, which is exactly what other countries have seen around the world. So it's not surprising at all that we've seen more cases.
What more can you tell us about the case up in Jefferson County?
The information I have is that this is a person who traveled internationally and returned to the United States and was ill about the time of returning. That person saw their own personal physician who requested a test. That test was performed, and those results were received by us just about 30 minutes ago.
Can you tell us the age range of this person?
I don't have that information.
Dr. Mackey, can you tell me, will this impact private schools as well?
This will not impact private schools. This is just for our public K-12 schools.
Okay. And then looking at the proclamation, there's some wording about days. Will the schools not have to make up these days at the end of the year?
That's correct. So under a state of emergency, there's a provision in the law that we can forgive those days, and that's our intention right now. Well, that is what's going to happen with these days. So for the days that are closed, that's a total of 12 days. They will not have to make those days up. I do want to say this too, though, on that, the purpose of this is to give the virus more time to hopefully mitigate the spread of this disease. And so even though we're closing for 2.5 weeks, we want students to be very cautious, not to congregate in large groups. They need to take this seriously. Families need to take it seriously, and as much as possible stay isolated, even though they may not be symptomatic. But we don't need large groups of people congregating together. We had put out guidance earlier today, canceling school events and some athletic events and other things where people would be congregating together in large numbers, and those are still in effect, and those directives actually go through the end of April. So we still want to make sure that people continue to self-isolate, that they continue to take care of themselves. All the things we've said about washing hands, about covering coughs, all those things still count, because even though schools close, this is our opportunity to hopefully slow down the spread of the virus.
What factors are you going to look at when determining whether or not to expand the closure for another week or whatever the case may
Sure.
be? What are those factors that are going to determine that?
Well, obviously, between now and then, we'll be working closely with public health. We'll be looking at is there an outbreak? Does this continue to grow? And if so, is it sporadic around the state, or is it statewide? Are there communities that are more heavily affected than other communities? Those are the kinds of things we'll look at. We also will be looking at how it affects our school communities. So one of the things, we'll be sending guidance out to superintendents this evening. One of the things we're going to be asking them is to continue to report to us, as we had asked them before, if there are students or staff or family members who have confirmations of COVID-19, because we want to continue to monitor that on a daily basis. That'll go into our decision about what we need to do as we approach the end of the month.
Dr. Mackee, for our viewers that may be just tuning in, can you repeat the days that schools will close and open?
Yes, school will close next Wednesday. I think that's the 18th of March. I got my day right. And then we'll reopen. So at the end of the day, on the 18th, we will close, and we will remain closed for 2 full weeks after that, with a target of reopening on April the 6th, Monday, April 6th. And I want to emphasize that as a target. We will reassess during the last week of March what's going on, working with public health, and make a decision during the last week of March as to what needs to happen next. But that would be our goal for now.
Dr. Mackee, how are school athletics impacted?
School athletics there will be no participation, no athletic events during this time.